health officials over the weekend reporting the highest number of new coronavirus cases a day in nearly 2 months here in the U.S. We're also seeing the number of hospitalizations on the rise here in the U.S. So joining us now for a little bit more about this, we have Dr. Angela Rasmussen. She's Columbia University's virologist. And Dr. Rasmussen, great to have you back on the show. Of course, we're seeing this higher number of people being diagnosed with the virus, including areas of the Northeast, which was hard hit a couple of months ago back in the spring. I think the big question right now is whether or not we're seeing the beginning of a second wave. What do you think?
I think that we may be. It's been very concerning to see cases on the rise over the past week. And we know that right now the weather's getting colder. We're not going to be able to do things outside as much. We're going to have to be gathering more indoors. And a lot of places are opening up for work, for returning to school. Some places are opening up for indoor dining. So I think that all of that spells out a pretty grim next couple of months for us.
You know, it's interesting as we see the number of case counts rising in the U.S. Of course, we have to bring up President Trump and what we've seen there over the last week or so. We have President Trump. He's hitting the campaign trail tonight. He's holding a rally in Florida. When you look at his past events, at least, I mean, they don't follow a lot of those basic health measures. How big of a potential risk do you think his events are to further spreading the virus?
I think they are an incredible risk, particularly the indoor events. We know for a fact that this virus can be inhaled and that people are producing more particles containing that virus when they're doing things like yelling and shouting and screaming, the things that President Trump's followers do at those rallies. When that's occurring in an indoor space, when people are not wearing masks and practicing physical distancing, that's a tremendous risk for what we call a super spreader event.
Hey, Dr. Rasmussen, Rick Newman here. If we had a different president, which we could in a few months, who sent out different messaging about COVID, wear a mask, do the things we all are supposed to know that are safe and will reduce transmission, would that actually make a difference? I mean, are people so fungible that if you just have a leader saying do it differently, it would actually improve public health?
Well, I think that's a great question, Rick, because I'm not particularly optimistic that we're going to be able to rapidly undo all of the confusion that has been created by the mixed messages that people have been getting so far during the Trump administration. I think that public health is something, and trust in public health is something that is gained in drops and lost in buckets. And unfortunately, we've recently lost buckets of this. It's going to take us a long time to recover and get all on the same page about the types of measures we need to be taking to end this pandemic and reduce the risk.
Doctor, it's been interesting to see the response to what we now consider a second wave. You look at the UK, for example, you saw the Prime Minister Boris Johnson there announce a 3-tier lockdown, depending on the regions of the country. Here in New York City, where we are, we've seen the mayor try to crack down on some zip codes, try to keep things open in other zip codes. And I'm wondering if you think that fragmented approach will still work this time around, because potentially we know a little more about the virus. Potentially hospitals are a little more equipped. I mean, what do you make of that approach if we never really contained the virus in the first place in the first wave?
Yeah, I think that the first lockdown really caused the public in general to distrust the concept of lockdowns. And while I think in some places, in some communities, they may still be warranted, we never really stayed locked down long enough, and people never got enough support to allow them to stay locked down long enough to really flatten the curve the way that we needed it to, the way that other countries successfully did. So I think that it's going to have to be a very community-specific approach from here on out in order to get people to comply. Because as we were just talking about, I think that there's a lot of people who just have pandemic fatigue. There's not a ton of trust in leadership and their ability to handle this and make the right recommendations. So we're really going to have to do it one community at a time.
Oh, do you want me? Go ahead. I'll go ahead. Sorry, Dr. Rasmussen. His question, and maybe it's silly. It probably is. Akiko mentioned the second wave. And I'm wondering, some people say, well, there is no second wave. It's just sort of one wave and it went down and then now it's back. Is it really important whether or not there is one wave, two waves? Is that sort of distinction not worth making?
I don't think it's really that important that we quibble with that. That terminology has been used a lot to describe things like influenza pandemics. Now, influenza is a seasonal virus, and in this country with this virus, we don't really know if it's seasonal yet. It hasn't been with us for a full year, but we certainly had a surge in the spring. We've had a surge in the summer. Now we're having a surge in the fall. So I don't really care very much whether you call it a wave or a spike or a surge. What's important to me is that community transmission is going back up again. We have to think of ways to stop that now.
Great.
Dr. Rasmussen, I want to just get your thoughts on some of the headlines that we got today in terms of AstraZeneca striking a deal with the U.S. government, securing up to 100,000 doses. We also had the Regeneron news, not only President Trump using Regeneron's antibody cocktail, but also the fact that Regeneron has also reached a deal with the U.S. government to supply, I think it's up to just around 300,000 doses. These are treatments that President Trump has been touting, obviously, after and following his experience with the treatment. Demand is going to be very high for these drugs. Supply is clearly going to be limited. How big of an issue do you foresee that being? And also just looking out a little bit further down the line, when do you expect supply on some of these drugs to finally or potentially meet the demand that's out there?
I think this is a really, really huge issue. And I think it's very unfortunate that the president has framed these monoclonal antibody cocktails the way that he has. We have 50,000 new coronavirus cases per day right now. Currently, Regeneron has 50,000 doses of that drug. 300,000 doses isn't going to be enough to treat 6 days worth of patients. So we are nowhere near having the type of supply to meet the demand that there's going to be. And furthermore, we don't even really have a lot of reliable data that this drug works. Giving the drug off-label to President Trump in the way that it was given with no controls doesn't tell us anything about that drug's efficacy. And he was treated with several other drugs as well. So we can't really make any conclusions about whether that drug even works. Now, this sort of thing has actually happened before with ZMapp, which was a drug that was given in the same sort of context to Ebola patients in 2014. When they did a clinical trial of ZMapp later on in 2018, they found that it didn't actually work very well. So I think that it's incredibly risky to be sending out this public messaging that Regeneron is in fact a cure, that these monoclonal antibody cocktails are the future of coronavirus treatment, or that there will be demand or there will be supply to meet the huge demand for these drugs anytime soon, in fact, even during this pandemic at all.
And Dr. real quickly, just to follow up on that, what do you think the potential backlash is here just for President Trump touting it as a cure? We heard Regeneron CEO obviously saying that this is not a cure, but just in terms of the public trust at this point, we know that a bunch of surveys have revealed the fact that the public is very hesitant, not only on the vaccine, but also some of these possible treatments. So what do you think the potential problem is there?
Well, I think that is a huge problem potentially for the vaccine, because the vaccine is what is going to be able to get us out of this pandemic. And if people are already, they've lost trust in leadership, they've lost trust in public health, they don't think that any of these vaccines or therapeutics work, and they feel that they're being lied to about, people are going to be less likely to take a vaccine. And this is already a huge problem, and it could be a potentially even bigger one. And that just means that we'll be living with this pandemic for even longer.
All right, Dr. Angela Rasmussen, great to have you back on the show. We hope to talk to you soon. Thanks for taking the time to join us.
Thanks for having me.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.